Now this is a little bit more like the multiple micro droplet technique, but threading it doesn't work very well in this region. I've tried that. So no bow and arrow technique for the nose as of yet. To be continued. I'm Dr. Dhir, a facial plastic surgeon in Beverly Hills. I want to show you my patients are real people who want natural results. Every consultation with my patients the first time should be about a half hour to 45 minutes. It's truly important for me to actually understand who the patient is, what they do for a living, and what their goal is. Kasia's not your typical patient. She's a makeup artist, so she really understands her face. She originally came in for two things. Number one, she thought her chin was too small, and number two, she wanted to smooth out her nose. She just didn't want people to notice she got work done. Hello, how are you?
Hello.
Dr. Dhir, welcome to the office. And it's Kasia or Kasia?
Kasia.
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 That's excellent.
Hi, I'm Kasia. I'm a makeup artist and I've been in LA for quite a while, and I'm originally from Poland. I'm turning 37 in a month and I'm starting to see little signs of aging, and I've decided just to get like a little bit of help. I'm excited to see Dr. Dhir. I've heard so many great things about him, and I hear he's very conservative, so I'm super excited to see what he's going to do.
We want to do minimal things, but you have something on your mind.
I do.
So
There's a couple of things I'm kind of concerned about, like my lid. I feel like it's slipping just a tiny bit.
Okay.
Also, I have tiny wrinkles around my eyes.
Okay.
And also my nose. I find that I highlighted in a certain way, which made me think if I had a little bit of filler right here, right in the middle, that would make it appear a little bit straighter.
Okay. Why is it that you want to change your nose after all these years?
I like my face. I don't want to seem like I don't like the way I look, but there are little things that if I can improve, I will definitely do it.
I completely understand.
Yeah.
There's only so much that Botox can do when it lifts, but I expect it, even if it was a little bit, you'd have an
Makes a huge
improvement.
difference.
And it's non-surgical and it's temporary, and I think it's fun to see what it would look like. And the smile big. And I would definitely just do a little bit of crow's feet right there. So that'll make you look more refreshed in the eyes.
Right.
Now let's talk about the nose.
Okay.
The nose is a really personal thing, and patients who come and say that it's personal, it's something that they personally want to do, make them feel better about themselves. And I understand sometimes patients say that to me that when you sit in a restaurant, you don't like people sitting on the right or left of you because it's a certain profile. So you've learned to do it with makeup and contour it, right?
Right.
Okay, so you already know what you already want.
I don't think about my profile as much as I'm talking about just looking for
On the front view.
front.
Yeah.
So just tiny bit here and here.
Yeah. You just want the sidewalls?
Yes.
So you're used to the hump here.
Yes.
You just don't want the pinch.
Yeah.
That is completely fine. And that's what you see in your nose?
I feel like it's more conservative. It's something I'm already used to because that's how I do my makeup.
Okay.
So that would just make it easier. But I did think about it, and if I had an injectable here, it would look a little bit like a beak. And
Correct, and we talked about that. It will look like a beak. I think it's a
Just
great
the point.
idea, and I'm totally on your side.
Okay,
And I think
great.
it'll be great to do a filler because if you love it, we'll keep doing it. If you don't, it's temporary. She was very interesting. She's already very attractive. And so whatever we do has to maintain that essence of who she is. Kasia just wanted a little more volume in the lower third of her face and to look more awake. It's a simple fix that won't be dramatic. Just to reiterate, we're gonna do the lips, we're gonna do the nose, and we're gonna do the Botox,
I'm
okay?
gonna put numbing cream on this.
No, we're gonna do something different, even better.
What is it?
Okay,
Laughing gas?
That would put your general anesthesia. No, I'm actually gonna go through the mouth and you're gonna feel nothing but just a little pinpoint. And what I'm gonna do is I'm gonna numb your entire lips so you feel no pain or discomfort, okay? Gotcha, I'm going to be doing my personal technique called the bow and arrow technique. In lip injections, there's different ways of doing injections of fillers. And one technique is doing micro drop techniques, which is multiple needle sticks across the whole border of the lip. And what you do is you inject small balls of filler. In my experience, I felt that a lot of patients don't like feeling little lumps and bumps of filler across their lips. And also, every time you inject and you get swelling here, it's very difficult to get the exact shape that you're wanting until the swelling comes down. And the shape that I want is a really, really natural looking lip. My favorite part of the lip is the Cupid's bow, and also the columns here, which are my arrow. So what I want to do is accentuate the top of the M here, or the Cupid bow, these triangles, by giving that beautiful shape and enhanced M. And then the bow part, which is here, I want to do the edge or the border of the lip. But to do that, I don't want to get all that swelling. So I use a needle that has no sharp end.
Okay.
So it looks long, but if you look at it really closely, do you see that? No sharp end whatsoever.
Okay.
It's actually soft.
Interesting.
It doesn't hurt when I put my finger on it. So I make a small opening on the side of the mouth, and I use this long needle, but what I'm doing is I'm going to exactly where I want to go. It's got no sharp end, so I don't hit any arteries, I don't cause any trauma, so your bruising and swelling risk goes down. And then I'm able to, from one opening, get the entire half of the lip, rather than micro droplets so it's lumpy and bumpy or put those balls. What I like to do is I like to do really flat sheets at different layers of the lip, so it actually feels like a full lip when you touch it with your fingers and feels really natural when you put your tongue on it, when you lick your lips, so you won't feel those lumps and bumps. And how's the pain level?
0.
0, that's great to hear. So I actually use 1, 2 openings, 3 openings, 4 openings, and then finally, just to get my Cupid's bow and the columns up to the nose to make it a bow and arrow, I actually go through 1 more and 1 more, which is only 6 needle pokes rather than multiple. So that is ultimately the bow and arrow technique. All right, Kasia, you did great on lips. Time to do the Botox. Smile really big and show me those
I
quotes.
don't know if I can smile.
You're doing great. Now relax, relax. That's the Botox. I use the smallest needle possible. Smile again. Good, relax. Great job. Okay, and then the brow lift, you do by putting just a little bit under your brow here. And you are done.
How was that? Not very painful at all.
All right, let's start your liquid rhinoplasty, your non-surgical nose job. Just like every other filler, I still believe that things can be dangerous, so you want to make sure you're injecting in the right place. Okay, she's totally numb. Any pain?
No.
All right, I think I'm in a good conservative feeling, make it straight, kind of what we talked about. So I'm gonna clean it up. I'm gonna let you take a look. I'm actually happy. I think we got a good feeling of the points that we talked about. So I'm gonna pass you the mirror, and I want you to take a look now.
I like it. This looks amazing.
And now that we've done the nose part, which has been something you've wanted for a long time, the lips are full and shaped. Now do you see the little things that you brought up here and here are not such a big issue?
Right.
You do little things that bother you, and eventually you'll see that all this stuff kind of settles in nicely.
Sure.
If we were to do this and this and you were unhappy here, you would never be happy about the things that like this. So this is why it's important to go slow, do what's bothering you first, and we can always move forward. So congratulations,
Thank you so
did
much.
good. I think Kasia was a perfect example why it's important to talk about all options. There is a surgical option, and there's always a non-surgical option, and there's pros and cons of each. We put a little filler in just to give her some contour, just like what she's used to do in makeup. Put the filler where she wanted it, and she was happy, and that's really makes me feel good. It is a little big right now, but that's where I stop, and I think that over the next couple days it's gonna settle down, and we'll see her for follow-up, and I think it's gonna really do well. Welcome back, how you feeling?
I'm feeling great. I'm feeling really, really good. I love what you did with my face.
That's like the
Looks
best
amazing.
compliment that I could have.
My face looks amazing, thank you.
That was the focus.
I love it. I love my face. It's such a big difference, but at the same time, such a small difference. I love my nose. My face looks a lot softer. I don't think anybody noticed my nose as much, but I totally see it and it makes a big difference for me. The moment Dr. Dhir did my lips, it kind of made me look like I took a big glass of water. I look so refreshed and my eyebrows look amazing and I have so much more fun with makeup. I had such a great experience with Dr. Dhir. He explains everything to you and you really feel like you're in charge of the procedure. I'm very happy with everything.
I'm happy with Kasia's result. She still looks like herself, and while the difference is slight, it's exactly what she wanted. To see more, Follow me on Instagram at Dear Plastic Surgery. You can leave me a message in the comment section, ask me a question, and I'll answer you personally, and tell me what you want to see next time. I'll make it happen.